Well, we're still on the breakfast program on TVC. Let's move on to another story now. The Nigerian Center for Disease Control say the death toll from the outbreak of cerebrospinal meningitis, called CSM, the serotype C in Nigeria, has hit 745. Northern Nigeria has the highest casualties, with Zamfara State recording over 300 deaths. Sokoto State had earlier reported 41 deaths, but that was before other deaths were confirmed in Shagari and Gudu local government area of the states.
David Ola, who once lived with his parents in this compound on Ofa Road in the old airport axis of Sokoto South local government area, is one of the victims who did not survive the deadly cerebrospinal meningitis, serotype C. He died last week Tuesday, shortly after being diagnosed as having the disease at the Usman Danfodio Teaching Hospital in Sokoto State. A neighbor, Mr. Thank God Enewaba, narrated how it all happened to TVC News.
That fateful day, he started complaining of being weak, So when he came back, he continued his normal day's activities. At night, they say he shouted and fell down. So the first hospital they took him, one private hospital, they complained they were suspecting meningitis. At Udut, the doctors there were contemplating whether to take him to trauma or to which other departments. Before you know it, he was dead.
Like David, many in the rural areas have died. Health workers are battling to save more lives. The challenge has been inadequate supply of vaccines, a sad reality which the federal government has acknowledged.
Vaccine is not freely available, unlike the others. WHO will only come to a rescue when there is a challenge.
Sokoto State says it has commenced the vaccination of 2 million persons against the type C strain of meningitis, but only a first installment of 20,000 doses of the vaccine has been received from the federal government.
House by house, and extract and pluck out patients that have suspected meningitis and take them to that health facility.
Mass vaccination yesterday in Gadalo government, but more should be done, because from my findings from a medical doctor, some of the causes are natural because there is intense heat. Unless rain start, this problem will continue to ravage seed sets, because according to him, he said the viruses causing the CSM thrive more under high temperature.
Many express fear that the death toll may continue to rise, considering the 50% increase in deaths officially recorded in barely a week. All right, we're now being joined on phone by medical doctor Olaliko Makinde. Olaliko, good morning. It's good to have you join us right now. A situation where over 700 deaths have been recorded from meningitis, and this is not the first time the epidemic, if I have to call it that way, is striking in Nigeria. We're thinking that Nigeria medical system should have been well prepared or ahead of hand before this occurrence right now.
You look about the medical system, but you know that the medical system cannot work except the government is doing what they're supposed to do in the first place. We have a case in Nigeria where the health system is in shambles, and the health facilities are not there, the manpowers are not there, and today people are leaving Nigeria, doctors, nurses, and health workers are leaving for greener pasture. So there's no way that things like this will not happen. Our emergency preparedness is very low, or maybe not even available, and then what we just do is trying to save face. Yesterday I was listening to the hearing, I think the Senate hearing on the meningitis thing, and one thing that struck me was that the senators or the people there were more interested in disease not coming to Abuja or getting to them. It was very obvious in the discussion they had yesterday, and I was taken aback. So this is what we have today. Our system is poor. We have what we need to have on ground. The facilities are not there. Rural areas, there are no facilities and all that. So that is why we're having this number of casualties at the moment. Okay,
but covering the emergency, so far we've received about 823,000 doses of vaccines. 1 million, that is coming from the UK, and 1 million from the UNICEF. You expect by now we should have a hang of it or be able to curtail it a bit, but why is the death toll climbing?
What you're trying to, let me explain to you. It's like there was a fire outbreak somewhere. I keep on saying this. It was after the fire outbreak that you're now looking for water, looking for hoses and all that. That's what's happening to us. Okay, we're supposed to be ready before it happens. Not when it has happened. We're now looking for vaccines all over the place. So people are already infected. You said this over and over again. Some people are already infected. They have to go through the course. Some of them will live. Some of them will die. And that's why we're having a high number of people already down after we have the outbreak. So our preparedness was poor, and we started intervening at the very late period. So what we're having today is the effect of a poor health system. We have to go back there, okay? Even the facilities are not there. People don't have where to go to. The other day we saw the people being treated on the floor, people using hand fan and all that. So that is the issue. And if this is not looked at again, by next time something else will happen, we are going to have the same story. In Nigeria, this is the same cycle we go through. We have an outbreak. We make a lot of noise. People send a lot of money to us and vaccine and all that. That one goes there. We go to sleep again. Another one starts. People start dying, and that's the problem we're having. It's a cycle. It's a very, very bad one.
All right, Olalekan, talk to us. You've talked about the issue of lack of preparedness or preparation. Give us an ideal situation. How should we have prepared for this?
Yes, we should prepare because we already know that Nigeria is the meningitis belt. So the government is supposed to have prepared that in case there's an outbreak. Okay. This is what we'll do, this is what we'll do, this is what we'll do. In other countries, they're ready for anything that happens. Okay? For instance, we talk about just some years ago, we had an Ebola outbreak. Do you know if there's an Ebola outbreak today, there will be a lot of problems because we are not ready for anything. We don't have anything on ground. For some countries that even have the outbreak, they already have vaccines that are stored somewhere. They already have people, they've already do some dry run. If this happens, this is what we'll do. This is what you are supposed to do. This is where the emergency will be, and all that. But we don't have all that because the government is not really interested in the people. That's what we see. They are only interested in the things that will affect them. And somebody was saying yesterday about the Abuja airport. Everything was done very fast. We had a lot of money was spent. Can we do the same thing for health? This is the question we're asking our government. No, because health is something that is so pivotal. But because they think, okay, once I'm okay, once I can fly to UK or the US, then I'm not interested. And this is the problem we're having. Until when we go back to the drawing board, we will keep on having this. By next time we have another outbreak, we'll keep on talking and talking. Then that one will go on its own. Then another one will start. And that starts the cycle. All
right. Dr. Olalekan Makinde, thank you for talking to us. That's the much time can permit us right now. Thank you.
Thank you. Thank you very much.
All right.